You're listening to the Food City Podcast, the show that takes you behind the scenes of your favorite supermarket.
From new products, expert tips on meal planning, and all things community, let's dive in and see what's in store today.
Welcome, everyone. We're here talking about diabetes. As we know, November is National Diabetes Awareness Month. It's very prevalent. 38 million people are diagnosed with diabetes, and many go undiagnosed in the United States. Any ideas on how many people go undiagnosed with those?
I'd say it's pretty high.
Yeah. I happen to know that the answer is over 8 million. It's right in that ballpark of about 8 million cases every year that go undiagnosed.
Which is a really scary statistic when you think about all the people walking around not knowing that they have it, so they're not doing anything to help kind of control it.
Yep.
Yeah.
And there is 1.4 million new cases every year. So that's pretty big.
That are going through.
I was just going to say, would you like to talk about what diabetes actually is defined
I think maybe
as?
setting the stage and talking about what diabetes is. Of course, most people are probably familiar. They might know somebody who has diabetes, have probably heard that it relates to blood sugar. Maybe they saw somebody who had, unfortunately, really bad untreated diabetes and had problems with their eyesight. And so I think it's certainly ubiquitous. It's around us, but understanding kind of scientifically what it is. So it's a chronic condition, of course, that basically affects the way that people who have it turn the food that they eat into fuel. So either the pancreas, which is an organ in your body, either it does not produce the hormone insulin or doesn't produce enough of it, or your body is not reacting to the insulin. It's not using the insulin that your pancreas is producing effectively. That would be a condition that we kind of refer to now as insulin resistance. Your body just isn't responding to it accurately. And of course, insulin is a hormone produced by the pancreas that acts kind of like a key that unlocks the cells of your body so that glucose or sugar can enter into those cells to be then used for energy. And so we know that when we eat foods, really all types of foods, especially carbohydrates, that has the biggest effect. It's broken down into glucose, into our blood sugar, and then it should be stored in our body for as glycogen to be used later on for energy. So Megan, do you want to kind of go into the different types? Because of course, not all of them are the same.
Right. Yeah, so type 1 is when your pancreas is not making any insulin at all. Type 2 is when your pancreas is either not making enough or your body is not responding correctly to it. And type 2, it's also good to mention, is it doesn't stay the same over time. It's a progressive condition, so things you're doing that's helping control it now, you might have to adjust in the future. And then gestational diabetes develops during pregnancy. Typically, the doctor will do the oral glucose tolerance test when you're about halfway along, maybe about 30 weeks along, to test your response to glucosen. So, and a good thing to mention too is gestational. If you develop it during pregnancy, it can increase your risk of developing type 2 later in life. So.
And your baby's risk of developing type 2 and obesity later in life too.
And what's important about that too is the complications of diabetes, if left untreated or not controlled, can be pretty severe over time. The eyes, the kidneys, the heart, just all the blood vessels, large and small blood vessels. So the more we can treat it and keep it under control, hopefully the longer you can prevent complications from forming and happening.
Yep. And for those who are listening, I think it's important to understand what lab values to look out for. Of course, your doctor should be informing you of these, but blood work is, of course, the main way that they're going to be diagnosing. There are some things that we can kind of look out for people who have diabetes. Sometimes they might notice increased frequency of urination, sometimes thirst, weight loss can be accompanied by your lab values are really what your doctor is going to use to diagnose that. So typically blood sugar will be tested, your fasting blood glucose, and the normal range should be under 100. And you can impact your blood sugar pretty quickly just by fasting overnight or kind of taking a couple of days to change your diet. So usually doctors are going to look more closely at what's called your hemoglobin A1C. Most people just call it A1C. And so the range that is considered normal is going to be under 5.7. I think some stricter ones might say 5.5 is normal, but a diagnosis of pre-diabetes would be ranges between 5.7 to 6.4. And what A1C is it's a measure of your average blood sugars basically for the past 2 to 3 months, which is why it can give a broader picture rather than just looking at one single value from overnight. And then for a diagnosis of diabetes, type 2 diabetes would be an A1C over 6.5.
Yeah. And I think a good thing to point out, too, when you're talking about the prediabetes levels is 1 in 3 people have prediabetes, which can be a scary statistic. But also you can reverse prediabetes. So when you get that diagnosis, you can't think, I'm just going to end up having diabetes down the road. You can really make some lifestyle changes and reverse it. It's 5 to 7% of body weight loss or exercise in 150 minutes a week can really make a big impact. And lifestyle changes can really help kind of further the progression of it.
100%.
Good
Yes.
point.
We're not going to be all doom and gloom on this podcast. We're going to give some hope and some recommendations for how you can actually reduce the risk of developing it altogether, reverse the risk if you have prediabetes, and then also tips for managing type 2 diabetes, whether that is solely through diet and exercise initially or through a combination of that and medication.
Right.
But let's go in first to who is at risk. We talked about if you're pregnant and you have gestational diabetes, that can increase your risk for later in life developing type 2. But who else is going to be at risk for type 2 diabetes?
People with a family history of type 2 are going to be really high at risk. If you have a parent or sibling that already has type 2, then your risk goes up. As we age, over 45 will increase your risk. And we're seeing the higher rates in children. And I think a lot of that has to do with increase in childhood obesity, less physical activity, poor diet. So that's kind of risk factors for that. And then our sedentary lifestyles, I think, are contributing a lot to it too.
Sure.
Yeah.
There are other things too, like ethnicity, if you got the history of gestational, things like that. But those are some of the big ones.
It's very multifaceted is the
Yes.
takeaway. I think a lot of people want to blame, eating too much sugar or too many carbohydrates or any specific one aspect of a diet and blame that on development of type 2 diabetes, but it's really not that cut and dry.
Right.
Unfortunately, there are a lot of different factors at play. We do know you mentioned poor diet, and that can be one of those things. We can maybe talk a little bit about what is poor diet? What does that actually mean? All right, let's kind of go into, you mentioned that prediabetes can be reversed, and I want to talk a little bit about improving insulin sensitivity. We've heard a lot more about insulin resistance in recent years. I feel like it wasn't as common to associate that with type 2 diabetes, but that's really what's happening. So insulin resistance can be improved, yes, through changes in your diet, but also through resistance training, exercise. All types of exercise can have an impact on lowering your blood sugar and helping to manage diabetes. Just getting 150 minutes a week of walking or even higher intensity exercise, but then the resistance training can help kind of train your cells to become more sensitive to that insulin.
Yeah.
So that's I think a really important thing. Let's go into a little bit about managing diabetes or preventing diabetes through our diet. Most people are aware that it has something to do with sugar and carbohydrate intake. You hear, you shouldn't eat carbohydrates if you have diabetes. You shouldn't eat sweets or sugar if you have diabetes. In reality, sugar is a type of carbohydrate. But it's true that not all carbohydrates are the same. Yes. It's also true that carbohydrates are not the only food that increase your blood sugar or have an impact on your blood sugar. We know that proteins can be broken down, especially during low carbohydrate diets, into glucose, or on low-calorie diets, they can be as well. So looking at the whole picture of your diet, it's really important to kind of balance those things.
that balance.
Yeah.
Yep. I'll talk a little bit more specifically about carbohydrate counting in a second, but if you want, can you go into a little bit, maybe for a simpler approach for somebody who is kind of just getting into this? They've got this scary diagnosis. They're overwhelmed with what to do. What are some simple strategies for a healthier diet to help manage this?
Yeah, sure. So a simple way is to kind of model the diabetes plate method, which you can find those resources on the American Diabetes Association website. And it's going by a method of using a 9-inch plate to put half of your plate being non-starchy vegetables. That would be like your broccoli, asparagus, things like that. And then a quarter of your plate being a lean protein or a plant protein. So you're talking salmon, chicken, grilled chicken, and then another quarter of your plate being a carbohydrate. And that could be your fruit or your whole grains. And just kind of balancing that and not having to stress so much about what your calories or what the carbs. I mean, there are definitely benefits in carb counting and being able to track it that way as well. But you want to get a good quality carb in that quarter part of your plate. And that's going to have fiber in it. And I would tell patients, anything from 3 to 4 grams and up for your fiber content in that little portion would be excellent.
What do you tell patients when you're kind of counseling on this plate method and they're like, I don't like green vegetables? I don't like any
other. They don't like actually the color green or all kinds of non-starchy vegetables.
Just non-starchy vegetables. Because I've run into that a couple times too, and I just keep listing the ones that they can eat. Salad is another good thing to put there too.
Yeah.
I mean,
I would recommend getting creative with the way that they're prepared.
Right.
Because a lot of
roasting.
people, maybe they have grown up with just boiled vegetables or canned vegetables, and those are great and fine. If you like those, perfect. But, roasting them with a little bit of olive oil, playing with the seasonings is going to be key. Putting them in soups, on bowls, all kinds of different ways to prepare. Sauteing them, stir frying them is another great way to get vegetables in, and pair them with a dip. Pair them with your hummus, pair them with ranch if you like to. I think that any way that you can get some non-starchy vegetables on the plate. I think stressing that balanced plate is going to be a relief for some people who previously thought that, you have to do very, very low carbohydrate or you have to cut out carbohydrates altogether, knowing that you can have at least that quarter of a plate reserved for what we're calling carbs or starches. You mentioned fruit and whole grains. Talk about what other foods have carbohydrates, whether healthy or unhealthy.
Yeah, so that's going to be your desserts, brownies, cookies, crackers, breads, all types of things. I mean, we're getting some carbs out of our vegetables too, but those are different types of, like I said, non-starchy carbs. But even though that desserts and things like that are considered higher in sugar, they still fit.
Yes.
I think you can still fit that I recommend at the end of the meal, just like we typically do a dessert at the end of the meal, just because so you can get that protein in there, get your fiber in your vegetables. And you're less likely to eat a bigger piece of that brownie. It's going to be a smaller piece. And then to take it a step further, just take a walk, and that helps with that as well.
Yeah.
So in terms of nutrition, really the things that are going to impact your blood sugar the most is going to be, one, the amount of carbohydrate that you're consuming, how much of it, so portion size. 2 is going to be the quality, what we are calling right now for the purposes of this podcast is quality carbohydrates. What we really mean there is, does it have a good amount of fiber in it? Is it whole? Is it kind of in its natural form and isn't stripped of beneficial nutrients? And then 3 would be, what is it paired with? So that's where the balanced plate comes in. You're having some protein with it. You're having a little bit of fat with it, because eating carbohydrates alone are typically going to have a much bigger blood sugar response than eating them in combination with other things that are going to help to blunt that blood sugar response and cause a slower, more steady release over time. So those are 3 really important things: portion size, quality or type of carbohydrate, and then what is it paired with. Another more in-depth way of managing blood sugars for people who have diabetes that is very common. Some people might prefer the plate method, but it's called carbohydrate counting. And we talked about which foods have carbohydrates, but really what it is, it's a method that just divides foods that have carbohydrates. So your potatoes, all of your grains, your desserts, your fruit, even milk and certain milk products, dividing those foods into units of 15 grams each. So each choice or each serving of this particular carbohydrate-containing food would have 15 grams of carbohydrate. And then you meet with a dietitian or a nutrition professional or a doctor that might give you a recommendation for how many of those choices you can have at each meal, paired with other foods, of course. And then you're eating that consistently at 3 meals per day to help stabilize blood sugars, to have more stable responses. And this definitely depends on the individual. It depends on your activity levels. It depends on your body size. It depends on your gender. But very often for men, they might be recommended to have 60 grams of carbohydrates per meal, and women maybe 45 grams of carbohydrates per meal. So that would mean, if you've got a prescription of 45 grams of carbohydrates per meal, then you're getting 3 of those choices. So that could be you're having 1.5 cups of pasta or, 1.5 cups of rice, or you're splitting that so that you're having a 1/2 cup of rice paired with a couple pieces of fruit, and that's going to be your carbohydrate serving for the day. And there are, of course, tools that we'll get into in a second about that can assist with counting those as well. This is also important, too, for type 1 diabetics.
Right. Yeah.
If you are a type 1 or an insulin-dependent type 2 diabetic, then you're taking exogenous insulin.
Yeah.
And it's really, really important that you're getting the numbers correctly so that you can take the appropriate amount.
Right.
And so that you don't run into low blood sugars in response for that.
Absolutely.
So that can be important. All right, what else is there to talk about in terms of nutrition when it comes to, you mentioned desserts. I like the tip of balancing your plate. For somebody who is maybe at a birthday party and they want a piece of cake, but they've gone over their carbohydrates or whatever it might be, what do you advise? What's a simple tip to be able to enjoy that?
My advice would be the portion control of that.
Yes.
Not just a big piece of cake, but you can have a small piece of cake.
Yeah.
And then, like I said, if you've already had pizza or other carbs that you are going to see that rise in your blood sugar, have the cake and then go for a walk. Like I said, that exercise is going to be tremendous on the blood sugar after having that carb load, so to speak.
And at the end of the day, you want this to be something that you can stick with long term. This isn't just, a few months, let's see if we can bring it down and then go back to what I was doing. So, treating yourself or, having it in moderation, just something that you can stick with is the goal.
Yeah,
so.
100%. All right, so going into maybe some medications. Obviously, for a lot of people who do have diabetes, it is not just about lifestyle and nutrition. Medication does play a role. So what are the most common ones that you would see, maybe some of the side effects and how they work?
Yeah. So the first line is usually metformin. It helps with insulin sensitivity. It does have some side effects, stomach issues. A lot of people have some stomach upset with it. And then also if you have bad kidney function, they'll probably shy away from that also. But that's kind of the first line agent that they use. The next thing that is, really popular and has shown great results with lowering your A1C are the GLPs, which are usually the once weekly injections like Ozempic and Mounjaro. They mimic your natural hormone of GLP-1, so it helps regulate your blood sugar, but it also decreases your appetite. So it's really helping people try and have healthier diet choices, kind of gets rid of that food noise that a lot of people have. So, and how it does that is it slows your stomach emptying, so it helps you feel fuller longer. So that's kind of one of the beneficial side effects that we're seeing with diabetic patients also. But some considerations, it can also cause some GI upset or nausea, stomach up problems. And it's not recommended for certain patients who might have thyroid conditions or history of thyroid cancer. So you always have to kind of weigh the benefits and risks with that. Another class of medications that's used a lot too are what they call the SGLT2 inhibitors. They just help your kidneys remove extra sugar, and that's going to be like Jardiance, Farxiga. and Invokana. And then if you're taking these medications, still not able to get your A1C down, then they might consider adding insulin. So it's possible to have insulin added to a type 2 as well. Just the main goal is to keep your A1C and your glucose under the range so that we're preventing the complications.
Yeah. Well, so what is that range that is the goal for?
If you're already diagnosed with type 2, then they want your A1C to be below 7. So
Yeah.
keeping it under 7.
So more modest than
Yes.
the kind of initial
Yes.
diagnosis.
Are patients able to come off of insulin after going on it?
It's pretty patient specific, but I think a lot of times, because where it is a progressive disease, your pancreas down the road might not be making insulin like it was when you were initially diagnosed. So it really, it's possible, but more than likely, it's a progressive disease. So,
Sure.
yeah.
Yeah.
And kind of circling back to the GLPs, we talk about how it does cause you to feel fuller and people are not eating as much. But I run into this a lot when I'm counseling patients, and you guys probably do too, is people just aren't eating because they're not hungry. So they're skipping breakfast or only eating 1 meal a day. So that kind of goes back to your, consistency, eating the 3 meals a day. Do you guys, see that a lot, or what do you, kind of counsel patients to do with it?
Yeah.
So, avoiding high fatty foods, things like that, spicy foods are definitely 2 high recommendations for patients on GLP-1s. Things because your stomach is emptying slower. You want to eat the foods that are going to progress through your system and not just lay there.
Right.
Yeah.
Yep.
And high fatty foods tend to, and the high sugar,
Yeah.
like the higher in carbohydrates.
Yeah.
Yeah.
And I always try and remind them your body still needs the fuel, even if you aren't feeling the appetite. So you do need to put some healthy foods into your body. And Food City has the tags, right, that
Yes.
kind of help people who might not really understand how to
yeah.
start shopping for this. They have the tags to help.
Oh,
The
yeah.
Carbo-Aware.
Yeah.
Yep.
No sugar added would be a really good one too. But yeah.
Well, and the Carbo-Aware is going to set the precedence that product has 0 to 15 grams of carbs per serving.
Okay.
So that's going to help guide with if you're doing the carbohydrate counting, as Nicole was talking about earlier.
Yeah, that's really helpful.
Yeah.
Yeah. And it might even apply to people who are opting to do a lower carbohydrate diet. Maybe they don't even have a diagnosis of diabetes, because not every tag or not every product that has that tag is going to have 15 grams.
Sure.
But some of them will kind of reach that range. So I think that's important. All right. So segueing again into some technology and resources. Now that we've covered medication and nutrition and lifestyle, what are some resources available to people who are looking to better or more effectively manage their blood sugars?
I think one of the most beneficial that we've seen lately are the continuous glucose monitors, or CGMs, and it's a sensor you wear usually on your arm, and it pairs to either their device or even your phone, so you don't even have to carry another device around. And it checks your blood sugar all day, so you can see trends. If it's dipping after certain foods or during exercise, or say you're having like a stressful event, you can see how that's affecting it, and it stores it. So when you go back to your doctor, he can look at all these results and come up with a strategy or a game plan moving forward. And then pumps, the smart pumps that, especially for type 1s, that you can program carb ratios or how many units you want to use based on what your glucose is. Then it just automatically injects it based on. So those are 2 of the most beneficial ones technology-wise. And I know there's a lot of apps that I'm sure you guys use a lot to help with carb counting or.
Oh, yeah. I think even something that's more comprehensive, that is a calorie counter, can be helpful, because a lot of them are tracking macros, so they're going to be just as effective for tracking carbohydrates. But like you mentioned, some of the more specific ones for people with diabetes would be the Carb Manager. I think that's a good one. Have you seen any
I
others?
think so too. And there's others out there. Food Educate, that's a good one. But yeah, there's so many resources for that out there.
Yeah.
Yeah.
I think, and this would be probably a good opportunity to shamelessly plug your program that you work a lot with, EPIC.
Yes.
That for associates who might be listening, or family members of associates who are on the health insurance program.
So we have a free diabetes education program that is you're eligible if you have Food City's insurance, or you have a family member on insurance and you have a diagnosis of diabetes. And what it is, it's we have 2 clinical health coaches, and we reach out to you once a quarter. kind of educate you, answer any questions you may have. I mean, you can reach us anytime, basically. We're not going to call and bug you, but we're here to kind of be the bridge of gap between the doctor or yourself. And, sometimes it's hard to get a hold of them to ask questions. So we're kind of here just to be that free resource for you. You also get savings with it on your diabetes medications and testing supplies. So it's just kind of someone to help come alongside you and help kind of you understand this new change in your life or how, any questions you may have with it.
Mm-hmm.
Yeah.
Yep, absolutely. Excellent resource.
Yes.
And it is really comprehensive. Does everything.
Okay, so let's do rapid fire.
Okay.
So eating sugar or carbs causes diabetes.
Myth.
Yes. Yeah. A lot of risk factors that go into it.
Okay. You can't eat carbs if you have diabetes.
That's another myth. We talked about balancing your plate and portion control. Those are going to be both really, really important in managing blood sugars.
What about only carbohydrates make your blood sugar go up?
Definitely a myth.
Yeah.
A lot of things can contribute to that. Stress, illness. We talked about proteins and fats can even, so a lot of different things.
Yep.
Exercise can lower your blood sugar levels.
That's a fact.
That's a fact. It definitely can.
Only adults get type 2 diabetes.
Unfortunately, that's a myth. We're seeing it a lot more in children and teens, so yeah, it's false.
Okay. All people with type 2 diabetes eventually need insulin.
And that's false. Yeah, that's a myth.
All good information.
Yeah.
Is there anything else that you guys want to add before we close this session?
I think if you're somebody out there who has been told by your doctor that you are now pre-diabetic, remembering that this isn't necessarily a life sentence, it is reversible. You can manage it. So adjusting that mindset. Yeah. Also for people who have a diagnosis of diabetes, type 2 diabetes, you can manage it. It is one of the few chronic diseases that we know is for most people, very, very responsive to changes in your environment, changes in your diet, changes in your lifestyle. So you are able to manage it in conjunction with your healthcare provider, your primary healthcare provider, your dietitian, doctor, endocrinologist, whoever it is that you have on board, and remembering that you need to be kind of communicating regularly with all members of the healthcare team because they're important.
And I think another important kind of thing that I would say is just to start small, like, set small goals. Don't shoot for, the highest goal first and feel like it's too overwhelming to do. So, just try and make little changes. If you don't exercise, try and do 5 to 10 minutes. If you don't drink water, try and drink more water. So just small steps, and then give yourself grace if you have an off day or an off meal. Absolutely. Just don't throw in the towel.
Yeah. And look for resources, like I said, on the American Diabetes website. You can find things about Mediterranean-style meals because, like I said, we're talking about eating and a plate method or counting carbs, but, what does that look like recipe-wise? What does that look like putting in the meal into play? So, yep.
Yeah. And with the Wellness Club, I'm sure you guys have a lot of good recipes out there for diabetics and pre-diabetes.
Yes. So the Wellness Club, people can sign up by going to the Food City website, or if you're in a Food City store, you can stop by and ask somebody on the front end to help you with that. It's attached to your value card, and it's completely free. It doesn't cost anything. You will get expert advice from dietitians like us. You'll get it from the Pharmacist as well. You'll get coupons, so special savings on healthy items, and then select recipes that are going to be good for you. And we have kind of a different theme. So, of course, November, we will be gearing it toward all things diabetes and things that are going to help in your journey for that.
Great.
All right, and we will see you back here next month.